So today will be a little bit more interactive because we are talking about a fitness topic. So as much as you can, we'll be practicing a couple concepts. Don't worry, you don't need too much space or we won't do a ton of reps or anything like that. I know that both of you have had some injuries before. So if we can talk about that briefly. So what we're talking about today is kind of a twofold concept. Obviously we cheer and both of you base, right?
Mhm.
So, as a base, obviously, it's important to be really strong, have a really solid foundation, but to be able to also branch that into our workouts to make sure that we are one, not going to get injured, and two, practicing at the best like mind muscle connection that we can. Those are kind of the goals of today's topic. So first, Ray, do you mind going first? Tell me about some maybe any injuries or any like imbalance issues that you've had in the past and what that looks like.
Yeah, so well, starting from this season, it was I rolled my ankle in like last year in the beginning of the season, just doing round offs. And then recently, before we left to Arizona, or no, I'm sorry, Colorado, that's when I don't know how it hurt my back. I just know we did a standing back and I kind of felt that it kind of tweaked a little bit and I stood up and was like, oh man. But yeah, just mainly those. My ankle's better now. I just am struggling with my back a little bit.
Okay, cool.
Mm.
Yeah, I almost forgot about your ankle.
All
And
right.
what about you, Eric?
So kind of like I explained. So I recently just I kind of have like a little wrist injury on my right hand, um, and and I've just been really trying to isolate it. But I realized that since moving over here, where I'm no longer in a college town. I'm with like a high school demographic of like cheerleaders and stuff. And so there's a lot of first time flyers. And Ray, I'm pretty sure you know how first time flyers put a lot can put a lot of strain depending on how you work with them. So I became like the designated base for making everyone a first time flyer. I'm about to make a program for that, I swear.
Strongman problems. I love it.
Yeah, yeah. So that whole I I've been talking to some other bases, and they're like, you need to calm down. Like it's cool, but like you're at the ripe age of 30, so like those those joints are gonna be as strong as they used to. So, oh my god,
Mm.
yeah.
Well, you can absolutely do something about it. So I'm glad that you bring that up too, right? Like we know that we only have one pair of joints. Obviously, you can kind of get replacements. They're getting a little bit better, but we don't want to have to anytime soon, right? All of us
Mm.
are around that same age of 30-ish. So the biggest thing is making sure that we're at least taking care of our joints that we do have now so that they can last as long as possible before we start having major issues, right? Now,
No.
both of you work out. So can you tell me, I'll have you go first again, Ray, the importance of strength training or working out or being active, and maybe the relationship that you've noticed with injury.
So I think the importance is, like just building that strength to for me specifically, like my back. I think it's important to, work out my core and strengthen my lower back because without it we can't, well, anybody in general, we can't flip our bodies or hold flyers up in the air as strong as we're able to. And then what was your second question?
Like how it might relate to injury as well.
So like you mean relating like the injury that I already have, or
Yeah, so either maybe like a deficit or if you notice that relationship between strength and injury at all.
oh, okay, yeah. So yeah, I noticed that when I am working out or like specifically in squats that I do feel my lower back. It doesn't necessarily hurt, it just
Mm,
feels tight.
okay.
Um or like if I bend my body a certain way, then yeah, I start feeling it in my lower back.
Okay, that's really good to know too, because one of the concepts that we're doing today is going to be breathing and bracing, so creating a really
Mm-hmm.
strong core foundation, and that should address a lot of the issues that you're having. So thank you for sharing that. All right, what up, Nathan?
Hello. Sorry. Just
You're totally fine. So we're just talking about strength training and the importance of it and how it might relate to injury for us. So Eric, tell us about, you said you usually lift heavy, right? Your goal is to be strong, or it was at least.
It was. So I
Mhm.
put a lot of. I was never a runner. I was a sprinter, but I was never good at endurance until it was football game days, and then all of a sudden I become like a professional. But in my particular case, I am switching toward cardio and endurance, as well as more like flexibility and really doing like high reps, low weights. My first problems I used to have was just like I had a lot of knee pain, and so I really started focusing on like temporarily for like my diet, and I would reduce it so I could take a less weight on the joints. But then I would also do like leg extensions. When it came to squats, I have my heels lifted up on a plate just to really take like the bearing of it. Back in 2021, I rolled my ankle severely bad. Like it bruised like a giant plum. It actually took away like just 30%, maybe like a quarter of my mobility in my ankle. So I can't load onto the heel anymore. I went to PT for that, but it really sucked because I had to adjust like how I stunted, how I did squats, and it's it's like I'm afraid to like really push it. I really want to do like the was it like the egg squat, like sit like an egg type of thing. I really want to be able to do that, but like I'm severely like petrified about like snapping like the tendon right there. So I'm increasing my cardio. I'm doing every workout now. I'm doing a mile run. I just did it yesterday and it felt amazing.
Awesome. Cool. Good to hear. And Nathan, what about you, your experience with, or why you think strength training is important, and then if you've had any experiences with injury?
Yeah. Um, I think strength training is important. Maybe, I mean, I guess if you're an athlete, I'm uh, not currently an athlete, but also, probably the most important thing I would say is long term, like as getting older, to have certain amount of strength at least, or like at a base level. I think of my grandpa, who's, I mean, he's in his mid 80s now, so he's older, but um, yeah, he's having a lot of trouble with the leg strength, and he's uh, there's only so much you can do when you get to that age. But also, I think if he had more leg strength, his life quality would be way better potentially, or right now. So it's yeah, an injury. I don't know if I ever had an injury directly, like a serious injury directly from uh, strength training. I mean, sometimes I'll hurt my back on a deadlift or something, but nothing that hasn't gone away in a couple days or something.
Cool. All right. The bracing concept that we use should also be really good for that too. I think that's one of the main lifting injuries for a lot of people is deadlifting, right? And then feeling it in the back. So we'll talk about a couple of those things. We won't necessarily go through specific exercises, but we'll talk through how to prepare for those. So to take away a couple of things that you guys are talking about, one of the things that I think strength training is super important for not only longevity, right, and being able to be stronger when you're older, which PS, side note, did you know that you can actually gain strength at the same ratio or percentage as you get older, but it just depends on what your original lean mass is. So if you can get lean mass now and then maintain that lean mass, you can actually continue to gain strength at approximately the same percentage even as you age. Isn't that kind of cool?
Wow.
Yeah. So I love that. So do something about it now. Maintenance is way easier than trying to make up for it. And then the more consistent you are, the better that's going to be as well. I was just talking to one of my clients about that. So that's the first one. Second one is resiliency. So I've heard a couple of you mention things where like, okay, something feels not super great while I'm lifting, right? But generally speaking, we know that the stronger we are, the stronger our bones are, the stronger our joints are, we're more resilient, right? And one word that I've heard for this is anti-fragile. I love that. Anti-fragile. So that's kind of the idea, right? So if we're able to prepare our body with this purposeful stressor of exercise, this purposeful stressor of strength training, then that can apply to anything and everything that we do, right? So that's one of the reasons that I think it's most important. Okay, beautiful. So the first thing that we're going to do, we're going to just dive straight into the exercises. is we're going to talk a little bit about mind-muscle connection. So I'm going to have you guys try a couple of things so that we can start to feel what our bodies are doing. And these might be concepts that you've already used before that you're familiar with. So I just want us to practice it so that we can kind of feel it too. So the first thing that we're going to do is actually going to be setting our shoulders. So the first thing I'm going to have you guys do is actually lift your shoulders toward your ear as high as you can. So this is our shrug, right? And then we're going to anti-shrug and pull your shoulders down. Let's do 3 of those. Lift the shoulders up. And pull the shoulders down. You're going to have an extra time with this one, Eric. I love it. Pull the shoulders up. Does this at all feel like when you're stressed and tense? And pull them down. Perfect. So seat them here. Feel how it's like kind of stretching in the traps and stuff. We're getting like nice and low. Everything's pinned in, right? So that's the first concept. We're going to go front to back next. So again, just practicing trying to be aware of what those 2 shapes feel like. So we're going to pull our shoulders forward and together, and then backward, and then try and squeeze your shoulder blades together like you're trying to pinch a pencil behind your back. Again, 3 times, forward and together, and back and squeeze. Last one, forward and together, and back and squeeze. Okay, so now we know all the directions that the scaps are going to move. What we want to do is create, like we said, a strong foundation. So the first piece that we're going to talk about is just this upper body. When you are lifting, obviously it's a little less applicable. Actually, it might be applicable to basing, but like prep level and stuff like that. But when you're lifting, we want to try and make sure that these shoulders are essentially just not a part of the equation, right? So let's say we're doing a back squat, we're doing a deadlift or whatever, we just don't want them to be dynamic. So what we're doing is trying to set them. And what I mean by set them is find a place where they are totally secure. Again, they're not moving, they're not a factor anymore, and then we keep them there, right? So one of the things I like to tell my clients is think armpits tight. So imagine that you have like a towel underneath your armpits and you're trying to squeeze it as hard as you can. That's essentially that feeling that we should have when we're activating our upper body, right? So we're going to take 2 of the characteristics that we just did, and I'm going to put a little asterisk next to one of them, but we're going to anti-shrug the shoulders down, and then we're going to externally rotate the shoulders back. So now they should feel like you are the tallest person in the room. I've got awesome posture, my shoulders are down, they're back. What do you notice about your abs right now, or your rib cage?
They're contracting.
Yeah, it's like a little bit open, a little bit expanded, right?
Mm-hmm.
So what we want to do is we want to keep this same tension we have. Armpits are super tight. Nobody's pulling a towel out of my armpits right now. And then we're going to take our rib cage that's flaring a little bit, and we're going to crunch it down as if I was doing a crunch. Now, how does that feel? Almost like you're fighting yourself, right? Do you guys kind of feel that? So we'll separate those 2 again so you can kind of feel it. So again, shoulders are down, anti-shrug, back, they're retracted. We're squeezing our armpits as hard as we can, but now we notice that chest is open. Close the chest down. Yeah. Do you feel that engagement through the core, through the armpits, through the lats? Everything's super tight. This is our deadlift position. This is our bar squat position to some extent. We kind of do an elbow drive and stuff, right? Does that kind of make sense so far?
Mm-hmm.
Cool. Any questions there? Beautiful. Okay, so that's the first piece, upper body, right? So we just learned how to close our rib cage. So we're going to open and close it a couple of times, just again, create that mind muscle connection. Because realistically, how hard, if you said 1 through 10, how hard do you think about what you're doing when you work out? 1, like not at all, and 10, like I'm on it, like concentrating 100%.
They're like a 6 or 7.
Okay.
I feel like I'm at an 8.
Okay, that's not bad. Yeah, let's go.
Yeah, about the same. I feel like I'm pretty concentrated so I don't drop anything.
Yeah, absolutely. Okay, great. Those numbers are all higher than I expected. So great job. I think a lot of people kind of just do the thing, right? So have you seen people do dead bugs before? And they'll like have this arch in their back, and then they're just like, doop, 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 doop. You know what I mean? Like that is not engaging like 75% of the muscles that you could engage, right? So you guys are in the higher range, so that's at least good. We want to make sure that we create that mind muscle connection. Okay, so we took care of our shoulders. We're going to do our rib cage next. So go ahead and put your hands on your ribs. We're going to flare them open as much as we can. And then we're going to close them down and crunch. Yep, but close, Eric. Right now, see how it concaved a little bit? We
Yep.
want to just close it enough to where we still feel impact. Yeah, right there, right there. Yeah, better. So then you should be able to like punch yourself in the stomach and it feels super tight, right? So feel those, open. Close just the rib cage, but keep air in there and should be tense. Good, one more. In. And close just that rib cage down, right? So we've got that home base piece. That's what I like to call it, home base, because everything's in that like nice, perfect line, right? We've got our shoulders set. We've got our rib cage set. Next one is going to be the glutes. So quick question. I might have already given the answer. What is your core? What parts of your body would you consider your core?
Oh, my ribs and diaphragm.
Down to what, I'm sorry?
Diaphragm down to say lower pelvic area, I guess.
Okay. Do we all agree? Now, do you can include glutes in that definition?
I want to say yes, but I don't know.
Okay, yeah, absolutely. So Eric says yes, Ray says probably, Nathan?
I would say probably no.
Okay, so, and I'm going to make the argument here. People will think about it differently, talk about it differently. Your core is from your neck to your legs. Anything that's not an extremity, right? Because this is your foundation. That's what we're working on today. This is your foundation, and it's going to set you up for so much success in all the lifts that you're doing. So that's why we just did your shoulders. That's why we just did your rib cage, and we're going to do glutes and hips next. This is your core, top to bottom, basically anything that's not an arm or a leg or your head. So just to make you think about it a little bit differently, because let's say that you're doing a push-up, right? Have you guys ever seen people do ugly, I call them bro push-ups, but like the ugly, like this thingy? Do you know what I'm talking about? Where their butt's up in the air, their core is not squeezed at all, and you're like, bro, what even is that? And the goal is for them to get their chest to the ground. So like, that's what, yeah, bro push-ups. I know you're all dudes, hopefully you're not offended, but if you're gonna have a push-up contest with your friends, that's probably what it's gonna look like. It's okay. So that's why we wanna make sure that we're engaging all of these muscles so that not only are we working whatever muscle we are working, but we're working as many muscles as possible. Gives you more bang for your buck, right? Like I would rather, even as a personal trainer, work out for less time and work more muscles all at the same time. It just sounds more efficient, right? Especially as a busy working athlete. Or not an athlete right now, that's okay. Okay, cool. So we got our shoulders, we got our rib cage, glutes are next. So for this one, Ray, just do what you can. Obviously you're seated right now. Same Nathan, sorry. So for this one, we're gonna go over pelvic tilt. So technically both of you can still do this seated. So what I'm gonna have you do is put your hands on your hips. For flyers, we usually talk about like guns, right? If you're holstering your guns. And then I want you to try and tilt your hips underneath, point your guns forward, tilt your hips back, point your guns to the back wall. So just the hips themselves, we're rolling under and back. A couple of those. And it's going to be the same idea as the rib cage. We don't want to go so far forward that we're leaning back, right? We only want the movement in the hips themselves. And the more control we get over this, the better we get, right? So again, going back to that home base, we'll do just the abs and the glutes right now. We're going to roll these two into each other. So kind of stick your butt out, clear your rib cage, and then we're going to close them both like you're shutting a door. So open, close, hit that position. Has anyone done kettlebell swings and felt it in their back?
Oh, yesterday.
Yep. That's
Yep.
probably because you're extending further, letting that rib cage go. That's the most common mistake, right? Because you're thinking about driving your hips through, right? And so you drive your hips through a little bit too aggressively. First thing that's taking it is that low back, right? And Ray, I know you're working with kettlebells right now, so that could be something to really pay attention to, right?
No.
Slam the door closed, keep that rib cage closed, and lock it in here. So it should feel closed here as we close here. Does that make sense? And that's going to make the world of a difference. So that's our home base. We're going to put all three of them together. Shoulders, rib cage, glutes. So now we've got our shoulders anti-shrugged, retracted, rib cage closed, glutes tucked. We've got this like perfect line. If I were to come push you over right now, you should be like immovable. Do you guys feel solid? Yeah, beautiful. So that is something that we want to apply to like every lift possible. When you're doing overhead press, same thing, right? That one usually takes it in the back sometimes. Close that rib cage, roll the hips underneath. We're in that nice, tight, strong position. We're doing our overhead press, deadlift, squats, basically everything, right? Same with push-ups, same with hip thrusts, all of it. So that's kind of the idea. Any questions about home base? No? Okay. So we might not get to everything. I taught this concept and it took a little over an hour and I was like, oh yeah, we could just like fly through it in half an hour. Maybe not, but that's okay. So the next one we're gonna do, I think we'll skip the planting and rooting today, but the next thing that we're gonna do is breathing and bracing. So the best way that I've heard this described is if you were turning a volume knob on a radio, right? Breathing is when you are the least stable and bracing is when you're the most stable. So if you think about bracing, when people are lifting like super heavy, like powerlifting, they usually wear like a belt, right? And that's because they need something to like keep everything super duper stable. So we can create a lot of that bracing, and you should, even if you're still wearing a belt, create a lot of that bracing ourselves, and then the belt is just accessory to it. Make sense? And then breathing is a dynamic open and close, okay? So we're gonna do a couple quick concepts. One hand on the chest, one hand on the belly button, and we're going to breathe. I'm gonna call this incorrectly. We're gonna breathe into our chest. So take a few breaths here, and I want your top hand to really move. You can kind of feel those shoulders rising, right? We're expanding the chest. This is that dynamic piece, right? Okay, so that's technically incorrect in terms of like especially lifting and stuff like that. So now what we're gonna do is take our top hand and have it be completely stationary, and we're only gonna breathe into our bottom hand, but still big dynamic breath in. Try to belly out as much as you can, and then exhale. Do you guys know when people do like food babies and they're like, like think that. Expand into your hand and then relax. You can even pull your belly button to spine if you want to. Good. Oh, all of you are keeping that top hand nice and steady. That's good. Beautiful. Okay, so now we know how to breathe into our bellies, right? So the next piece we're going to talk about is bracing. So it is going to be breathing into your belly, not into your chest. But what it's also going to do and or feel like is like you're holding your breath. Like if you were preparing for somebody to punch you in the stomach, what would you do? Right? You'd tense up, you create volume here, right? You'd squeeze everything because they're coming at you and you want to be as strong as possible. Same thing when we're lifting, right? So what we're going to do is we're going to put our hand on our belly. We're going to expand the way that we did before, but it doesn't have to be as big and dynamic. We're just going to breathe into our belly button until you feel it moving a little bit, and then we're going to hold that for a second. And what I want you to do is feel around, push around your abs, and see if you can get it to be so tight and engaged that there's no way somebody's punching you in the stomach. Can you feel it? Okay. Nathan, you feel it too? Okay, cool, perfect. So that's the first piece. Second piece is that we also want, it's called intra-abdominal pressure, but we want 360-degree, front to back, side to side bracing, because if we only brace the front, only have a big belly, then like our lower back is still not protected, right? So the next piece that we're gonna do is try to breathe into our sides. So you're gonna put your hands on your side. I usually do finger and thumb. And you're gonna do that same breath in to your belly button, but I want you to try to expand this way instead. So try to expand into your fingers on the sides. Let me know if you're able to do it.
A little bit.
A little bit. It takes some practice. And that's one thing too that I think not a lot of people do is taking time to create these foundational concepts, right? Powerlifters, you best believe that they practice their breathing. Eric, did you ever do powerlifting?
I did powerlifting, but I actually learned all my breathing techniques from choir.
Hey, there we
we
go.
call this elevator breath if you're wanting to know what it's called.
All right, so we've kind of got the sides going a little bit, yeah? Beautiful. All right, and then the last piece, which is probably the hardest one, is going to be breathing into our back. So if you want, you can still put a hand on the front, but what we want to do is that same breath, but try to feel it in your low back. So that hand should actually move because it's moving front to back too. Or you can use the whatever you're sitting against to press it against. How are we doing on that one?
I don't really feel mine as much.
Okay, yeah, and that'll take some practice. So I would definitely practice that one in particular if that's something that you struggle with. So now that we've got a basic concept of that 360 pressure, we're just going to create that same brace that we talked about earlier. But right now, the first time we practiced was just in the belly, right? Now we're going to try and expand 360. So Ray, you can stay to the sides if you need to, and then keep practicing with the back. But go ahead and breathe in. And then I want you to hold your breath for the first one, poke around a little bit. Tell me if you feel secure. Yeah?
Not as much in the back.
Ooh, okay. So you'll have to practice that one too, right? One of my favorite ones for practicing breathing on the back is actually being in like this little nugget child's pose and then breathing into your rib cage. So that's a good exercise for that one. Okay, cool. So now we've got the brace idea. So this is the hard part. Breathing while you're bracing. So you can put yourself on mute if you want to, but what we're going to do is the same thing. We're going to create that expansion front to back. And then I want you to tell me what you had for breakfast or lunch today. So you're going to go, hey, I'm going to talk to you while I'm still holding this. I'm going to feel that tension everywhere in my 360, blah, 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 blah. I'm still talking, taking small sips of air. Yeah? And if you want to keep talking, you can. And go. And it can be small, soft breathing, small, soft words if you need to, kind of recontracting each time you feel like you're losing it, but still breathing because it's really hard to lift for a long time without breathing. Once you get a couple sentences in, you can come back off mute and let me know how that felt.
It's difficult. It's harder for me.
Yeah.
But I think mostly because I've been learning about like breathing techniques, but I've been learning a different breathing technique where you use your whole entire lungs, your chest, your upper chest, the three sections of your lungs.
Mm-hmm.
So like it's hard for me to just only use like my stomach.
Okay, so let me play devil's advocate a little bit here. If you use all three regions of your chest, where does that breath end up?
In the chest?
Close. So think about your diaphragm, right? We know that it lives kind of here. If we feel all the way through that diaphragmatic breathing, if we feel all the way through the whole lungs, the diaphragm actually moves down, right?
Mm-hmm.
And then where does that put all the breath?
Into our core or into our stomach.
See what I mean?
Mm-hmm.
So same concept, different way of thinking about it. Right? And there's definitely ways to use dynamic breathing while you're lifting. There's two things, and I'll just briefly hit them. Valsalva maneuver, where you actually purposefully hold your breath and then create that brace and do whatever the movement is, or creating that brace and using the exhale but on the contraction itself. But all of those concepts are still trying to create as much or get as much air into your body as possible and create as secure and like filled of a core as possible. Do you see what I mean? Does that make sense, Ray, or any contradictions?
Yeah. I just what I've been learning is like how to breathe normally, like throughout the day, not necessarily through exercise.
Yes.
So,
okay.
Absolutely. Yeah, I think that also plays a part in it.
I will have to remember the name, the oxygen something. I'll send that book title over to you, but it is awesome about exactly that, breathing throughout life and how you can use it to your advantage, for sure. Okay, any questions? Did anyone have any issues when they were trying to practice that bracing?
Well, I think it'll just take practice. I'm used, I guess when I'm lifting, I'll just kind of breathe in and out. I don't really think about like push out when I'm trying to push the weight. So I don't really think about where the air is, if that makes sense.
Yeah. And like we talked about engaging as many muscles as possible, we should take advantage of that breath too, right? Like totally use it for your contraction. But when you do that, we don't want it to and deflate you. We still want that brace. So it's nice and sharp, but you're still protecting yourself. Does that make sense? So yeah, it'll take a little bit of practice. Awesome. Any other takeaways?
Well, I guess just what I learned right now is when you're pushing weight, that's when you want to breathe out.
Yes, kind of. Asterisk. When you're contracting the muscle. So my two favorite ones to explain are the opposite directions. So yes, when you're pushing weight, let's say you're doing an overhead press, you'll exhale there. Let's say you're doing a bicep curl. Technically, the contraction is on the pull, right? That's when your muscle is squeezing. So when you're contracting the muscle or working like the hardest to overcome gravity, that's when you'll exhale. Does that make sense?
Mm-hmm.
Yeah. Absolutely. Eric, any comments or takeaways?
Hey, sorry, I have a tired child. So I guess some takeaways is just learning how to make it most efficient to brace, but also allow yourself to breathe without trying to pass out.
Yeah, without trying to pass out. Yeah, totally. Cool. Awesome. I love it. And it does take some practice. So definitely start incorporating it in your workouts. You might even have to go heavier, the opposite. You might have to go lighter, there we go, when you're trying to implement these in particular, because it's going to be hard to concentrate on all the same things at the same time, right? And then last thing I'll leave you guys with is one of my favorite breathing exercises is if you have a band, put it around your waist. So kind of like we just did with your hands, and then try to breathe into the band and push it out, right? So whatever direction you needed to practice the back, we're expanding and breathing that band out. And that's a really good way to be able to actually feel how dynamic and like how much tension and pressure you can put in there, right? Cool. Okay, awesome. Obviously, you didn't get to the nitty-gritty of specific lifts, but try to think about these, especially when you're setting yourself up. So let's say like a deadlift, because a couple of you mentioned that. When we're at the bottom, instead of just pulling, get down there, create your brace, keep it packed in, and then pull off the ground. And I'm telling you, it make the world of a difference. Let me know how it feels. Cool, awesome. Thank you all so much for coming. Last question I have is for tomorrow. I want to do a lifestyle topic. So I've got two in particular that I'm thinking of. A is going to be time management. And then B is going to be habit formation. I've heard a lot of people talk about their consistency issues. So time management A or B, habit formation.
I say habit formation.
Okay.
Habit on my end.
Habit, yeah.
Yeah, that sounds good.
Okay, cool, perfect. That's the one. All right, easy peasy. Awesome. Hopefully I see y'all tomorrow. Thank you so much for coming, and let me know if you have any questions.
All right.
All right, talk to you soon.
Yeah.